So hello everyone, welcome to the next part of anesthesia. So in first part we will learn about the pre-operative things, what we do, how to take history, what are the guidelines which we have to do in anesthesia. Then we learn about the drugs, IV agents and many more. So today we will learn about the inhalation agents and other things which we do in anesthesia. So let's start with the ECG, or we can say echocardiogram. ECG or echocardiogram. So preoperatively there are 12 leads. So you can know there are chest lead, limb leads and other leads. Okay. But intraoperatively we use third or fifth lead. Intraoperatively we use third or fifth lead, because it is easier to know about this. Because of this third and fifth lead we can know the patient is having any problem or no. So there are no needs of putting more the leads, because during the operation the space must be there to operate. So that's why we put to third or fifth lead. So what does echocardiogram do? It will tell us the detection, like patient is having arrhythmia or heart attack, myocardial infarction is there. Due to this we can know. So for ischemic heart disease we'll put fifth lead or fourth or fifth lead. Like if we put fifth lead it will give 70% of detection, and if we put both the leads then it will give 90% of detection. So this part I explained in my ECG video, but still there are inferior wall myocardial infarction, lateral wall, anterior wall and intraventricular septal MI. So these are the leads which we check during the anterior wall MI or lateral MI. So next part is pulse oximeter. I think pulse oximeter everybody knows, because during COVID time everybody had this machine in their OPD, or we can say in our houses also. So what pulse oximeter do? It will just check the oxygen in your bloodstream which is flowing. So it will give you a accurate thing that in your blood how much oxygenation is there. So how you will put the pulse oximeter? So on your finger, for example, here should be red light and infrared red light, and downside there will be photosensitive light. So you will put like this on your finger. But if the patient don't have both hands, so what you will do? You will put on the toe, earlobe, tongue. So these are the parts where you can put and know the oxygen in the, like by pulse oximeter you can know the hemoglobin, or you can say oxygen in your bloodstream. So these sites I already told you now. The next part is invasive, non-invasive blood pressure machine. So this also everybody, like most of the Indians have in their house to check the blood pressure of their grandparents or maybe parents. So why it is used? To know the systolic and diastolic blood pressure. Okay, and it is also known as by the name of oscillometry. Then there is another one which is invasive. This one was non-invasive, but this is invasive blood pressure, and this invasive blood pressure is to point, like every beat to beat is monitoring your blood. So why we need this? Need this for cardiovascular disease, any massive operation where will be more blood loss, and other like pacemaker is there or cardiac arrest will be there. So in that conditions we put the invasive blood pressure machine. So what is a common site where we put invasive blood pressure machine? It is radial artery. So there will be a line which will be put in your radial artery, and it will give beat to beat monitoring. And always remember, which I told you, in the monitor it is always shown in red color. So invasive blood pressure always shown in the red color in the monitor, and it should be to beat monitoring. So as you can see, this is the patient, and as you can see this line is put, and we are checking his beat to beat monitoring of the blood. Then central venous cannula. So most common site for putting central venous cannula is right side. So because it is shorter and it is more straighter, and so it can easily reach to the heart. So but there are so many complications, like pneumothorax can happen, carotid puncture can happen, and like arrhythmia, air embolism and AGV thrombosis can happen. So always there is a method to put, like always do you ultrasound guidance and then you put the cannula. Okay, so which is the monitor to use measuring the depth of anesthesia? Like in simple way, if you give anesthesia to a patient, so how deep he is in a sleep or how unconscious he is, to check that thing we have spectrometer index. So for example, you gave anesthesia but the patient was paralyzed, but he was able to listen all the things during the operation. It will be so dangerous, or you can say so risky. So to know about the depth of the anesthesia, we use bispectral index. So it will tell you about the depthness of anesthesia. For example, if 0 to 40, if the patient is between 0 to 40, it is so deep in the anesthesia. But if the patient is between 40 to 60 on the scale, so it is ideal. But if the patient is above 60 and in 100, so the patient is aware. So it will be more dangerous for, because one case was there happened in America. The patient was aware during the operation, but he was not able to move his body parts. He was paralyzed, but he was awake and he listened all the things about the doctor which was going during the operation. So he put case on that people, and doctor have to pay the penalty of that thing. So always check the depth of anesthesia before the operation. Like you gave anesthesia, before starting the operation, you must know the depth of the anesthesia. So this is the spectrometer. It will be a band on sticking on a forehead, like there is a band of this, and it is put on your forehead, and it will tell the depthness of the anesthesia. So monitor and their normal value, like heart rate 60 to 100 beats, then oxygen at more than 95% of at room temperature, BP 120 by 80 by systole by diastole, and capnogram CA2, what I told you in the first lecture, which is 35 and 45 mm mercury is normal. Peripheral nerve stimulator. Okay, so it is also known as train of 4 monitor, and it is put on the, also known as neuromuscular monitor, and it is put on your ulnar nerve. Okay, just remember this thing, because I think it will not come to you now. It will be like on the PG level it is asked, but still remember this thing, it will be helpful. So this monitor we already talked, like this is heart rate, this is ECG, invasive, non-invasive, temperature, capnograph, all we taught in the first part. So 4 things which we use in operation theater, which is bispectral index monitor, which is help for depth of anesthesia, then invasive blood pressure, which tell us about the beat to beat monitoring of oxygen in the blood, then central venous cannulas, okay, and train of 4 monitor, which is put on the ulnar nerve. Next, move on to the IV induced agents. Okay, that one GABA. Okay, so propofol, thiopentane, etomidate, and one ketamine. Okay, so these 3 act same, and this one opposite to them. Always remember, like heart rate, they will decrease, blood pressure, intracranial pressure, intraocular pressure, this all will decrease. These 3 agents will decrease, but ketamine will always increase, like shock, hypotension, trauma, and that it is drug of choice. For example, a patient got a patient got an accident and he is in a shock. His heart rate is decreasing, his blood pressure is decreasing, his intracranial pressure is decreasing. That time what you will give? If you will give these agents, he will die. So to stop this and to do operations for them, we use ketamine. So ketamine, what it will do? It will help in increasing the heart rate, blood pressure, intracranial pressure, and intraocular pressure. So always use this. But a patient has head trauma. So like for example, a patient was going on the road and suddenly a truck hit him. So he got injured on the head. Already due to blood loss, or you can say due to hitting by the truck, his head cranial pressure is more. That time if you will give ketamine, it will increase more and the patient will die due to anesthesia or due to shock. So it is contraindicated in head trauma. But if the patient is just having trauma and due to trauma his BP, heart rate is decreasing, that time you can give. So it is the choice in the shock, hypotension, and trauma. The next one is thiopentane, most alkaline IV induced agent. So it is a class of drug, barbiturate. Stabilizing agent is sodium carbonate, and it need pH of 10.5. Okay, iodine is injured, like it is choice, like in neurosurgeries it is given, and hyperthyroidism it is given. Then this no need. Most dreadful complication. Okay, if you put it in artery, it will form a crystal in the artery. If you are giving thiopentone and by mistake you put in the artery, it will form there a crystal. You always give it in the vein. Okay, remember this, you always have to give in the vein. So vein के अंदर ढूंढ के लगाना है, because if a crystal will form, it will give vasospasm and the patient will die due to ischemia, or it will get shock. Okay, and it is contraindicated in prophylaxis of cardiovascular system or asthma. Okay, propofol, like whenever there is IV agent and you don't know the answer, always mark propofol, because it is mostly used in the daycare surgeries and other parts. So if you don't know the answer and there are options are given and mostly you don't know the answer, always mark propofol, because most of the chances this answer got corrected. Like always get correct. It's all act on GABA receptor, first of the thing. It is the most painful drug. Whenever patient tells you, doctor, like I went to the operation, that time they give me anesthesia and it was so painful, go mark the answer propofol, because it is the most painful IV injection. Like, and it is made by eggs and soybean oil. Okay, so always use it during 6 hours, like because egg and the soybeans has a attracting microbes, like microorganisms which are present in the air, and it is a good culture for them to get replicate and to grow. So always use that medicine, like IV agent like propofol, in 6 hours, not more than that. If it is more than 6 hours, discard it. It is milky white in color, and for example, now it is made by eggs and soybean. If a person have egg allergy, will you give him the propofol? No, you can't give, because he will die due to shock, or you can say anaphylactic shock you can get. So better avoid in the patient who have egg allergy. Don't give him propofol. The dose is 1 or 2.5 mg per kilogram. Look here also given. Once it is given, use it in the 6 hours. It is best antiemetic and antipyretic. It is metabolized in liver. So propofol infusion syndrome. What is propofol infusion syndrome? If you are giving propofol for more than 48 hours, it will failure of metabolism. Then what will happen? Cardiac failure will happen, lactic acidosis will happen, and patient will death. Like if cardiac failure will happen, the patient will die. So always remember this one point, propofol infusion syndrome. Like never give more than 48 hours, because if you give propofol for more than 48 hours in the long surgeries, the patient have more chances to get this syndrome. Okay, the next part, which is ketamine. We already talk about the ketamine. It will increase all this part. What is agent of choice, trauma, and where you will ignore, and it is act on NMDA receptor. Okay, so if it will dilate, like for example, it will do bronchoconstriction. What we need in asthma? We need like in asthma, bronchoconstriction is there, so we need dilation. So ketamine will dilate the things. That's why oxygen will reach lungs more. So it is agent of choice in asthma. You can use in full stomach patient also. For example, always before operation we tell the patient, don't eat before 8 hours, don't take any food or anything, but still the patient was like having some problem and he took the food, and that time you can use ketamine, because ketamine will stop the reflux which are coming back from the stomach to the mouth, as you can see as I written here. So ketamine can use in that patients which had full eated stomach, he did full meal every time, and he came to the operation and he tell doctor I ate full thing and then I came to operation. That time ketamine is a drug of choice. Okay, it is increased secretions, dissociative anesthesia and emergence delirium. What happens whenever you give the ketamine to a patient? he will feel that his body and soul, that kind of thing, that he will tell you after the operation, doctor, I was able to watch my operation from that side and this side. Due to delirium or dissociative anesthesia, it happens to him. So patient feel like soul and body are different from each other. So this happen due to, this is just like we can say side effect or some effect of the ketamine. Etomidate, and it is most cardiostable drug. So whatever it is cardiostable drug, then it is a drug of choice in cardiac surgery. Adverse effect, it is give myoclonic jerk, cause adrenal suppression, then cortisol production will decrease. So this was about the IV drugs which we use. Now we will study inhalation agents. So what is MAC? MAC is minimum alveolar concentration. Okay, give the potency of agent. Higher the MAC, less the potency. For example, 100 ml of beer will give you a kick, but if you take 100 ml of vodka, it will give you more kick. Like in 100 ml of beer, nothing will happen some people who drink always. But if a person will take 100 ml of vodka, he will get a kick and he will be in the next world. So like this, higher the MAC, less the potency is there. This is just an example. Do not drink alcohol. So halothane, isoflurane, sevoflurane, methoflurane, these are the MAC of them, everyone, like 1.16, 1.07, 1.45, 2, desflurane 6, and the most highest, this question came in the recent exam, which is NO2, which is have 104 MAC, maximum MAC it is have. So let's study one by one the vaporizers. So yellow color vaporizers, you can see it is isoflurane. So I will tell you one thing about isoflurane. It is sweet smelling, so it is given to the children because they are not allowing to put IV. So we will just give them to smell isoflurane and they will sleep because it has some fruity smell. Then sevoflurane. Then purple color is isoflurane, red color is halothane. But desflurane has special vaporizer. It has a special vaporizer which is Tech 6. So remember this. These are the vaporizer which are put in the ventilator machine. So let's study one by one now. Halothane, bronchodilator in asthma, ureterine dilator in postpartum hemorrhage. Arrhythmia does not use in cardiac patient, like it can cause arrhythmia or heart attack in the cardiac patient. So avoid to use halothane in the cardiac patient. Halothane hepatitis, as it causes autoimmune distribution of liver, it can cause hepatitis. Now isoflurane, which is purple color vaporizer, best for liver surgeries and neurosurgeries. So isoflurane you will use in neurosurgeries plus liver surgeries. Cause coronary still phenomena because blood from ischemic area will go to the profused area. Okay, so these are the exception. You must remember about this thing because every time these things are asked in the exam again and again. So never make that mistake that this point is not important, that point is not important. Whatever important points are there, and I think I had experience of giving an exam once. So whatever I feel that important, I make that PDFs and I share to you. So do not skip whatever I am giving you. It's 100% you must remember. Now sevoflurane, it is yellow color or we can say kesaria color inhalation agents in the children's, like it is sweet smelling and agent of choice in cardiac surgery. You can give him in the cardiac surgeries also. So you can see lidocaine, bupivacaine and intralipids. Cocaine is a local anesthetic. Okay, let's study now local anesthetic. Blocking of NM plus channels neurons, thus blocking the generation and conduction of action potential in the nerve. For example, this is the nerve and these are the channels of Na plus. Okay, so what will the local anesthetic will do? They will just block these channels. Okay, so if the channel will block, the patient will be in a it will not able to move his hand, so motor and then sensory everything will be stopped and the anesthesia will work like this. So order of blocking nerve fibers. For example, BP will decrease, autonomic block will be there, then sensory block will be there, and motor block will be there. How to know that is the patient got motor block? You will tell the patient to raise his legs. Okay, if he able to move the legs, he is not in the his motor is not blocked yet, but he is not able to lift his leg above, then it is blocked. Which is the first sensation is lost during the local anesthetic, which is cold sensation. So whenever you will take local anesthetic, first thing will be you will not feel any cold on that hand or the leg or the body part, whichever body part you are taking. Okay, so first temperature loss is there, cold, then pain will be lost, touch, deep pressure, and proprioception. So these are the order which you will lose by taking the local anesthetic. Classification according to the chemical structure. This I taught you in the pharmacology of anesthesia, like ester linked and amide linked. So ester are short acting, where amide are long acting. Metabolized by plasma esterase, and here it is metabolized by liver. Then excreted in urine. Allergies due to PABA, and here the examples are lignocaine, buicaine, ruavicaine, pilocaine, and here is procaine and benzocaine. Okay, remember this, like this also I explain in pharmacology, but still I am repeating here, so you will get an idea what the things you have to learn about other part of this subject. Ester, local anesthetic metabolized in liver is only cocaine. Only ester that metabolized in liver, because ester links are metabolized in plasma esterase. Okay, this is the only one exception, that cocaine is metabolized by liver. So what are the actions of there, like duration? Short action is like procaine and chloroquine. Intermediate is lidocaine. Long duration is like buicaine and rubicaine. So what is last? Local anesthetic sympathetic systemic toxicity. Local anesthetic systemic toxicity. So what is this? Like for example, if you are giving local anesthetic to a patient and you give directly overdose of it by mistakenly, that you forget and you give twice of that, so what will happen? Brain and cardiac problem will occur, seizure will have, and the patient will go in the coma. So at that time what you will do? As you give more local anesthetic, the patient will have this problem. Patient will start hesitating, tenesmus will be there. So at that time you should take intralipid IV injections and put in the patient IV, because it will save the patient from dying. So as you can see, treatment is like it is an antidote for that thing. Like you gave local anesthetic and the patient will go in the coma. So to stop that thing and to bring that patient back, so you will give intralipid infusion as soon as possible, because the time you gave the overdose, the patient will start having the side effects. So management of blast, which is given intralipid infusion. Like what is the bolus dose? Like bolus dose is the first dose. You will give 1 ml per body weight. Like you will calculate by the body weight of the patient and you will give over 1 minute slowly 20% of intralipid. Then followed by infusion again. After 1 hour you will repeat the dose and continue CPR throughout the treatment with intralipid. So this thing you will do, because once the patient will be in anesthesia, he will not able to take breath, he will not able to move his hand, nothing. The patient will slowly die and it will go coma or something will wrong happen. So that time you must act so fast and give intralipid for the first minute, then again that was the bolus dose, then again repeat after 1 hour, and throughout that process CPR must be given. So this was the thing for today. So we talk about now the IV agents, inhalation agents, pre-operative things, post-operative things. Now in the next part we'll study about all the instrument which you use in anesthesia. So for today, that's it.